back with us this afternoon. Thanks for being here, Doctor. Before we get to some questions, we do want to talk about water safety, especially with young children with the summer being here.
Yeah, absolutely. If you're a parent, there's been a point in time where you look one direction and you look the other way, and one of your youngsters is gone, and it's just that quick. And when you're around water, the threat of danger has to increase, and you have to be aware of that. It's important to teach your child about safety. It's also important to have life vests on that are authorized by the Coast Guard. A lot of things that we can buy, floaties, things along those lines, will not keep your child up unless they're Coast Guard authorized in the event that they're alone and you don't know where they're at and they're in the water. I would also recommend teaching your child to swim or tread water as soon as possible. And it's also very important for you to be CPR trained in life-saving techniques. In an event of an emergency, those type of things can make the difference between saving a child's life and the child unfortunately losing their life.
Another question here from a viewer. My friend recently tore his Achilles tendon just by walking. I recently started a running program, and now I'm having pain. So how do I avoid tearing my tendon?
You know, it's always scary when you hear one of people that are your age and very close shape that you're in as well, just walking along and one of their tendons pops or something happens to them, like a knee tendon tear or ligament tear. But I think it's highly unlikely that you're going to tear that area. More likely is that when you first start running, people tend to go out right away out the gate. They're very motivated. They start to run exactly for what they want to instead of training, even if they haven't been running prior to this. So gradual increase in exercise will be appropriate. Stretching prior to and after running is also appropriate of this area. And if you have pain, make sure that you have the appropriate shoes on and pick a surface that's soft. Concrete or sidewalks are not ideal. They may be the safest. They're going to give you the most pressure back on your knees, your ankles, and your hips. And if you continue to have pain, see your healthcare provider. They can do a quick ultrasound evaluation, physical examination, and make sure of the inflammation around the tendon and the integrity of the tendon.
All right, Dr. Szepiela, thanks so much for being here this afternoon.
Thank you.
Tomorrow on Ask the Expert, the lawyer's in answering your legal questions. Remember, you can always email them to us in advance at news@13abc.com.